Well, good afternoon, everyone. My name is Sean Egan. I am the Director of COVID Workplace Safety for the state of Michigan and the Deputy Director for Labor in Michigan's Department of Labor and Economic Opportunity that you can see on your screen. We're engaging today with East Lansing, home of the Michigan State Spartans, to talk about COVID-19 and the things that we need to be doing to make sure that we contain COVID and we get open and stay open, moving our economy forward. If you've been with me before on some of these webinars, much of the information will sound familiar to you, but we're trying to focus in and concentrate on getting open and staying open in the college environment, recognizing that this presents some unique challenges, not because of young people, but just the scale and the population change and the immediacy of those folks coming to town and how our businesses interact with students to make sure that we understand and we keep moving forward together. We have to fight against this urge and this our complacency that's building around COVID. We know that COVID, we've been struggling with this for quite some time, and we're all getting a little bit tired and a little bit fatigued with COVID, but unfortunately it's going to be with us. All signs point to these continued challenges, and we have to make sure we wake up, stand up, and get moving forward and keep it going the best that we can. And I want to encourage you all that are joining us today to make sure you share this information out. Certainly when you have a webinar like this, we share a lot of great information and tools that people can use, and it's important that you share it because you're self-selecting into this webinar. There are many businesses in your community that have a stake in this COVID containment that will impact your business and your workplace, that you need to make sure that they're doing everything that they can to be a part of the solution as we move forward. I can tell you that the governor has convened a lot of discussions with university leaders, including those at Michigan State, around the state for weeks now. We've been meeting and discussing different plans and opportunities and challenges. And I can assure you that Michigan State has thought through very thoroughly the way that they're going to manage their campus life, their student housing, their classrooms, and those things that they can control. What we're really here to talk today about are those things that Michigan State may not be able to control or influence as strongly, which are all of those things that surround the campus, that rely on the campus and rely on those students to move forward. So we all have a role to play, and we have to think beyond what we have to do, and we have to be thinking toward what else can we do to contain COVID in our communities and make sure that we keep moving the stages of reopening forward. We expanded our discussions. If you've been with me before, it's largely just been me, but we're including today Barb Sebastian from the Liquor Control Commission and Kevin Selmeyer, the fire inspector, to talk and be able to answer some of those questions that come in around those things. And I want to stress that you cannot forget about local action. Local public health in the state of Michigan has a lot of authority to help with things, and I know that in East Lansing and Lansing in general they have. These could be reducing that gathering size. Right now, the executive order allows outside gatherings of up to 100 if you can social distance and you're wearing masks. Local public health can shrink that. Some cities, and I think East Lansing may be among those, have done ordinances or other tools to hold landlords accountable for the things that are going on in the housing that they provide. Some of the campuses that we've talked with or cities have hired security for certain kind of spots that they know are congregation points. One was a particular lot where a lot of people will meet and gather on weekends, normally vacant. They've hired security to help break up crowds within those areas. And we're going to talk through today the things that you need to be doing, which are those preparedness and response plans to COVID, the daily health screenings, the masking requirements, the limitations on capacity, posting signs and notices and closing areas of your establishment, and other tools that you may need to take a look at. But as we get rolling today, we just can't stress enough how critical it is that it's not just the college's plan, it's not just your plan, it's our plan, because in this environment with COVID, it can spread so quickly that if we get into situations where we find the quote unquote bad actor, it's already spreading in our communities. So we have to really corral this together to make sure that we're having the impact that we want to have. And as I mentioned at the top, our goal in the Department of Labor and Economic Opportunity is pushing to get open and be able to stay open. And what's going to drive that are our numbers. Now we know that Michigan's had just shy of 89,000 confirmed COVID cases. About 1,500 of those have been in Ingham County. And if you look on the right there at the graph, you can see that the age groups that where those cases are more prevalent fall into that 20 to 29-year-old age category, which certainly lines up with those college student age people that are going to be coming back to campus and engaging in our communities. And that's that complacency and those things that we all have to work to mitigate to make sure that we can keep things moving forward. One of the greatest tools that we have, as I always mention, we have a 24/7 news cycle. We have a lot of noise about COVID, but some things have remained static through this whole ordeal. That's the critical importance of social distancing, keeping that 6 feet or more of separation. This virus is largely spread through large respiratory droplets and aerosols that we create when we talk, sing, yell, shout, sneeze, cough, you name it. And that social distance allows those things to disperse without potential contamination of the other person. When we can't maintain that social distancing, we need to be wearing those face coverings. About 40% or so of those believed to be spreading this virus are asymptomatic, meaning that they will never feel sick. And another high percentage are pre-symptomatic, meaning they feel fine at the time. So in that case, these face coverings are believed to cut transmission between two people by about 70%. So if we have a lot of people that feel fine, that can spread the virus, we're going to be within that 6 feet of social distance. We need to be wearing these face coverings to really cut the transmission, and hopefully we'll see that play out in our numbers in Michigan moving forward. And then certainly good hygiene. You can still contract the virus through touching a contaminated surface and then touching your eyes, nose, and mouth. So maintaining that good hygiene practice, washing your hands, using the sanitizer, all of these things are critical. So when we think through what you need to be doing for your business, keep these things in mind: social distance, face coverings, hygiene, to try to really mitigate what's happening there. And suddenly all of the executive orders and the workplace guidelines that you're seeing from the CDC start to make sense. Those are the goals, is to reduce the congestion, reduce the numbers congregating, try to maintain that social distance, and where that can't be maintained, wearing those face coverings, and then always practicing good hygiene to make sure that we're not contaminating ourselves through another mechanism. To reopen and operate safely, you really want to focus in on the executive orders, make a good faith effort to adhere to the guidelines posted, train your employees on health and safety practices, conduct those daily health screenings, and you can find more information at Michigan.gov/COVID-Workplace-Safety. There are guidelines that I'll touch on in just a minute posted there, and then certainly the phases of reopening and the approach to re-engagement you can find at the Michigan.gov Michigan Safe Start Plan. We're looking at really 8 steps that keep workers and customers safe when you're thinking about what you need to be doing in your place of business. Those may be engineering and administrative controls. Now, when we say engineering controls, that means physical changes. That would be the barriers, changing your ventilation system, something that's going to be more permanent. And then administrative controls are things that you can control as a manager. That would be staggering breaks and lunch times, when people start and stop, how your leave policies work, and the rest of these are primarily administrative controls as well. So access control is who is coming into your place of business. Today, we're really focusing on those public businesses, so that'd be bars and restaurants and retail, and certainly you have less access control. For those businesses that do not have the public component, you should be controlling both the employees coming in. That would be using that health screening to make sure that you're keeping people out of the environment that shouldn't be there, as well as visitors and vendors and contractors coming in and out. And then distancing, how you're spreading out your workplace to make sure you're maintaining as much social distance as possible, specifically that 6 feet or more. Sanitation, on how you're cleaning. That's both just daily regular cleaning to make sure we're containing COVID, as well as your plan to deal with an outbreak or somebody that becomes sick in your premises. Hygiene practices with your workforce, as well as having sanitizer available potentially for customers, the protective equipment you're providing, face coverings, face shields, etc., and what you're doing on positive case protocols, including notifying public health and potentially doing that facility closure to do a deep cleaning and make sure that you're containing COVID from your workplace from being the source of a COVID outbreak. So we have a quick guide that we use. This video is available on a website I'll mention later. It's got great tools and great information for you that it will just run through quickly.
For food service employees and their employers, there are new ways to work safely to help reduce the spread of COVID-19. Designate one or more worksite supervisors to implement, monitor, and report on the COVID-19 preparedness and response plan. Develop daily entry screening protocol for employees and contractors. Display a door or sidewalk sign with the services available, instructions for pickup, and hours of operation. Reserve parking spaces near the front door for curbside pickup only. Limit capacity to 50% of normal seating. Require 6 feet of separation between parties or groups at different tables or bar tops. Close waiting areas and ask customers to wait in cars for a call when their table is ready. Create or post communication materials for customers, including instructing customers to wear a face covering or mask until they are seated. Close self-serve food or drink options, such as buffets, salad bars, and drink stations. Require hosts and servers to wear face coverings. Food preparers should wear face coverings and gloves in the kitchen area when handling food. Install physical barriers such as sneeze guards and partitions at cash registers, bars, host stands, and other areas where maintaining physical distance of 6 feet is difficult. Limit number of employees in shared spaces. Provide physical guides such as tape on floors or sidewalks and signage on walls to ensure that customers remain at least 6 feet apart in any lines. And wherever you work, here are some guidelines and safety precautions for you to do your part in reducing the spread of COVID-19. Limit close contact with others by maintaining a distance of at least 6 feet when possible. Minimize handling of cash, credit cards, and mobile devices, and wash or sanitize your hands after handling. Practice routine cleaning and disinfection of frequently touched surfaces and tools. Wash your hands regularly with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth. And be sure to follow these safety precautions. Wear face coverings or masks. Check for symptoms that often include fever or abnormal cough or shortness of breath. Stay home if you are sick or have been in close contact with someone who is sick. Report your diagnostic test results and exposures to your employer, and participate honestly and urgently in workplace safety training. For additional resources, visit Michigan.gov/MIOSHA.
There are other guidelines and additional information available to you. And we're going to turn it over in just a second here to Barb Sebastian with the Liquor Control Commission to talk about some of those things, including that 70% of gross receipts that they've received a lot of questions on. But we'll jump back into the guidelines in just a minute or two. Barb, I'm sorry, we had it backwards. Kevin, we're going to turn it over to you first. I hope you're ready for the Bureau of Fire Services. And we've asked him to come on to talk to us a little bit about some of those capacity limits and other work that they're doing in this space as well.
Hey, good afternoon, Sean. Can you hear me?
Yep.
Good, fantastic. Okay, thanks for the opportunity to be here today. Just wanted to share that a lot of times we get questions about college and university classrooms and dormitories. There is Executive Order 159, which allows colleges and universities to designate classroom space that hadn't been approved in the past. That has been put in place to create social distancing in the college environment. One of the things that I think a lot of people don't know this is that the State Fire Marshal's Office, the Bureau of Fire Services, the state agency, we actually have jurisdictions in places of public assemblies. Public assemblies are definitely restaurant, bars, and clubs and those type of environments. And some of the ones that are listed on here are closed at this time. So, but we definitely want to interact with the locals, and I share that because We have 22 fire inspectors throughout the state, and that if there were situations to arise that we needed to get involved, it is definitely going to help with the relationships that we have with the local fire departments. So that is definitely something that we want to make sure that we're fostering, and that's part of why we're being involved in the call today, is to develop those relationships. And I'll be available. And then we also look to the local fire departments in many cases. Once you get outside of the public assemblies, the other buildings that are in areas and venues are going to fall under the local fire department. We want to make sure that we can help them with educating, and that is also something that we're able to help with at the Bureau of Fire Services, is calculating capacity. I think sometimes, you know, in the video it showed a bunch of tables and it says reduce it by 50%, but not all the rooms are always perfectly shaped, or there are bars in an area, or it's a long bar. So those questions do come up, and we are available, and we definitely want to help with that, as well as your local fire marshals. So, you know, we're here. We want to work with local government and our state partners, and my phone number is up there. That's my cell phone number. I'll answer 24/7. So if you have a question or you have a situation in your community that you're looking for some help with, please reach out, and I look forward to interacting with you, and we are here to help.
Thanks, Kevin.
You're welcome.
We have Barb Sebastian from the Liquor Control Commission.
Hi, good afternoon, and thank you for inviting me to be part of this program as well. The Liquor Commission enforces the state's liquor laws and rules. We also have been responsible for enforcing the executive orders currently. We work with all kinds of businesses, bars, restaurants, bowling alleys, manufacturers, wholesalers, anyone who's got a liquor license. We want to make sure that they're in compliance and that they're operating safely. We do check businesses who are in violation of the laws or the executive orders. Typically, our main goal right now is educating. We will take action in some egregious situations. We also work with local police departments and partner with them on working on assignments. We provide them with money so that they can also enforce the liquor laws and rules and the executive orders. We also provide education to licensees so that they understand what's expected of them, typically in groups as opposed to single businesses. You can see the website information for us is available there. We have lots of great resources there, information about COVID, reopening resources, information about new laws and permits that have come up during the COVID crisis that might help out your business. Please feel free to go there and see what resources we have. If you can't find information, you're welcome to contact me at my email address there, and I can guide you to any information that you're looking for or provide it to you. Just a couple other quick points I was hoping to make. At Liquor Control, we are committed to helping businesses getting open, staying open, doing it safely, doing it legally. We know, unfortunately, that the indoor bar scene has been uniquely suited to transmit COVID. A lot of that has to do with human behavior. People in these environments a lot of times are getting closer to each other, loudly talking, crowding each other, drinking alcohol, which lowers inhibitions and good judgment. All these things have a factor there. We're very concerned that young people are on the rise as far as an age group in getting COVID. They are almost up to the 60 and 69-year-olds as far as transmission rates. We're hoping that that can change. All of you have a part in that, and we're here to help you if you have questions or if you need information. I did want to mention too that typically we do expect that your patrons and your staff will all be wearing masks at all times, except for people who meet the exceptions in the executive orders. Your customers can remove their masks for eating and drinking. You can ask them to remove the mask to check their identification and to verify that they're of legal age, their state of intoxication, things like that. So that is an option you have as a business owner. Thank you. That's all I've got.
Thanks, Barb. And other resources available focused on the workplace safety aspects we've been discussing. You can find a pile of information at Michigan.gov /COVIDWorkplaceSafety. We have guidelines created for every industry that's been named in an executive order, and that certainly includes bars, restaurants, and retail. We have some checklists and some fact sheets there that you can use to kind of point you in the right direction. Make sure that you're starting with the preparedness and response plan. There is a template preparedness and response plan there for low and medium risk workplaces. If you don't know what that is right now, that you should hopefully know what that is. You're going to have to categorize your workplace. If you are a bar, restaurant, more than likely you would be medium risk. And we do have a template there that you can work through on a preparedness and response plan that will help you get through that plan. There are posters there and other information that you can use, like the no mask, no entry. It's the law. Waiting areas are closed. They should be closed. The dance floor should be closed. Performance venues are closed in these areas. So those are things you're definitely going to want to take a look at and make sure that you're doing correctly. There are a bunch of other posters here that you can use. There are social media resources that you can use and share. We have videos similar to the one that we showed you that you can use. We have other information posted on our Michigan Leo website, including some things that we're trying to highlight more that I want you to consider and think about on ventilation controls. Believe it or not, we're about 6 weeks away from evenings indoors when it starts to get colder, and we're going to need to think about how we're controlling that indoor air quality as it relates to COVID. And there are some resources from ASHRAE, which I won't go through the full acronym with you, but that they are the gold standard for heating and ventilation thought in the United States and do a lot of different work. We have some information posted there on some steps you can take to get your air exchanges up per hour to help mitigate COVID, some filter changes, some standalone filter thoughts you could have, and we're working to develop more of that, but think about that. The Ingham County Health Department, if you're in Ingham County, you should be doing the health screenings already because there was an order early on from them to do that with a form template that your workers should be using when they're coming into work. And they have other resources available that you should check out there. The Michigan Workplace Safety website, we have a great Michigan Economic Development Peer Michigan Business Connect platform where you can connect to Michigan manufacturers that are manufacturing that PPE that you need, the face coverings, hand sanitizer, plastic barriers, and other things. Definitely check that out. If you are making some of those things, I know that distilleries switched over to hand sanitizer, that you can also connect your business to sell off of that platform. So definitely check that out. On the health screening components, there is a My Symptoms app, which was created by DHHS with the University of Michigan, that will allow your employees to do the daily health screening via an app. As an employer, you sign up for the app and you'd be given an employer-specific number. You share that with your employees and they will be linked directly to you each day before they come in. If they would just open the app, they can do that on their phone or a desktop computer, do the health screening questions. It'll tell them if they're good to go or if they are flagged with possible COVID symptoms, and that will cover the health screening components for you. For some industries, it's also required that you're doing a temperature screen, but not all industries. And we have links to the Michigan.gov Safe Start, as well as the Mask Up Michigan campaign that DHHS has put together with resources and posters you can use there as well. So definitely a lot of resources available, a lot of folks trying to help and be there. But again, just to reiterate how important it is that we're all connecting. Another great tool that I want to highlight that you have available to you, it's been available since early in the crisis. The MIOSHA team was quick to set up this hotline for COVID-specific questions about workplace safety from employers or employees. If you're an employer and you have some questions about types of barriers or anything that has to do with workplace safety and COVID, call in to A555 Safe C19. The average wait time on those calls right now is about 15 seconds. That's right, 15 seconds. And the average call length is about 4 to 5 minutes, depending on what your issue is. If you need further assistance, they can get you over to our great consultation team. MIOSHA has a wonderful consultation and education program with consultants that can help you evaluate your workplace and get you through some of the planning and other things that you need to be doing. If you're an employee calling in, and it's necessary, they can get you over to the complaint side of the MIOSHA process, and that will trigger an investigation and inspection through their MIOSHA processes. But this is a great tool for you. Make sure you remember it and use it. A555 Safe C19. And with that, as we do, we will just turn it over to the question and answer portion of our program. We do our best. These are off the cuff. If we can't get through them all, we are doing more of these. Feel free to check in. We have a lot of great resources on these websites that I mentioned that you might be able to find some questions and answers to, and we will do our best.
All right, thanks for that, Sean. A lot of great information, and for Kevin and Barb sharing it as well. For those of you who haven't already, there is a Q&A tab within this webinar event, and you can still submit your questions. And Sean, Kevin, or Barb will answer those during this live webinar. So with that, I'm going to go ahead and dive in. The first question comes from Megan, and Megan asks, how will this affect the student apartment move-in process? We normally see 1 to 2 days of large crowds numbering from 200 to 600 people through our doors each of those days. How does the 10-person order affect us?
That is a very interesting question. I can tell you that for on-campus housing, certainly MSU and other universities have taken steps to try to spread those things out to some degree. If the 10-person limit is for an event or an indoor gathering. So if you were bringing, your whole extra family with you, that's going to be 11 or more people, you're not going to be doing that. What you're going to want to do is minimize the number of people that you bring with you to move in, and we would anticipate staggering that. We would want landlords and on campus to be staggering the move-in dates to make sure that we are minimizing the number of people at any given time. And as a father who is dropping off a student in just a few days, I can tell you that at MSU, that is what we're seeing. So definitely try to schedule your time and stagger your times.
Perfect. And should my employer be taking and recording temps of all employees when they report to work?
So certain employers are required by the executive orders to take temperatures. Those include manufacturing, meat packaging, and casinos at this point. So they will be taking and recording temperatures. Other employers are encouraged but not required. I always encourage employers to consider it if it's viable in your workplace, because as we all need to work, as businesses need to operate, sometimes the temperature limit's 100.4, and sometimes some people won't really notice that, and some people will feel okay enough to work, and that temperature screening will be sufficient to flag that. And if they are taking it, I would definitely record it.
Perfect. And what are the fire code guidelines for house parties, and can you regulate those? Kevin?
Yeah, I think when we start getting into, especially when we're getting into, off campus, we get into that is definitely where we're going to need to involve local law enforcement. And those are, collaborative efforts that we need to, that's one of the reasons why we're doing the calls today, but we're trying to get those relationships built ahead of time so that we can get those crowds dispersed. It may be, just something to share, to kind of build off of that. It may be actually that through law enforcement, or it could be ordinances that are already in your communities that limit noise. That might actually be one of the better ways to disperse that party. So we want folks to be thinking about that ahead of time, because when it does occur, there's going to be a lot of notice that's going to happen, and then we're all going to have to react. So a party at somebody's house is not at a public assembly. It's totally different than if it was going to a restaurant or bar, as I shared earlier. So that's having that relationship. And I would also ask communities to look at that. Do they have ordinances that are in place? Many times, most communities will have a noise ordinance for it can only be so loud, or even certain parts of the day, and those definitely could be used to disperse that party.
Well, that's a good segue to our next question that asks, if bars in college towns are restricted, how do we stop someone from hosting a large house party?
Sean, you going, or?
Yeah, well, you're still live, so why don't you jump in first, Kevin?
All right. I think that's where there has to be with the local law enforcement, that when they start to see that the gatherings are starting to occur, the best thing is if we can catch them on the early side when the groups are just starting to gather before we get to the big groups. But it is a little bit different as opposed to a public assembly. Even when liquor control can get involved in some cases, we get off into the private parties. That's where it's really a local law enforcement issue to disband those parties. And
I would add that, oh, go ahead, Barb, I'm sorry.
Sorry, I was just going to add that we have authority over liquor licensed places, not over house parties or individuals. So unfortunately, we would give that same advice. They're going to need to work with local police. Thank you.
Yeah, and I would add, I think it's important to remember that the executive order prohibits social gatherings, not just for the bars and restaurants. I think it's important that everybody remembers and spreads this message all the time that it's not as though the restaurant is per se unsafe. It's a congregation point, and that's what these executive orders are trying to minimize, is how many of us are in one place at one time and keeping that social distance and wearing the face coverings and these things. So the executive order actually applies to all of us as individuals too. So if I'm having an event at my house with indoors with more than 10 people, I am in violation of the executive order. If I'm doing it outdoors with 100 people or less, but I can't social distance, we're not wearing face coverings or anything else, we're all in violation of the executive order. So there's some personal onus, and to Kevin's point, like certainly on these calls, like we can tell you that we have tools to enforce, and we do, but there's a piece where it's going to take all of us kind of collectively to make sure that we're pushing the right way. And noise ordinances, public health maybe setting a lower threshold on gatherings. Certainly in those places that we regulate normally, there's things that we can do to support and help. But we get that comment, we understand it, and we understand it's a legitimate concern, but it's going to take local public health, local law enforcement, ordinances, councils, colleges, all of us to really take some ownership over containing COVID.
Thanks for that, Sean. Kevin, we have a follow-up question. It looks like for you, wanting to get some clarification on what the relationship is relative to the rules and what the fire department can do in terms of house parties.
Well, I think even the fire departments, it's having that relationship ahead of time with the authority having jurisdiction in law enforcement. You look at East Lansing. East Lansing has a police and fire department. I think if you move into some areas, you may have a college or a university that is maybe in a township, and sometimes it's the sheriff's department that is the law enforcement agency in those areas. But it's that's what we're really trying to do. And I think Sean is really stressing that it's an opportunity for us to have these discussions now ahead of potentially having to deal with these parties and these issues. And it's the locals sitting down and coming up with kind of, if this happens, then we'll do this. I also think that something that Barb shared earlier, even from the liquor control side of it, is that we're trying to educate ahead of time. And so that's really what we're trying to do here with these phone calls, or these live streams, is that we're trying to get the communities to start thinking about some of these things so that they can get together and plan for, if this happens, then this is what we will do. What we want to share also, though, there is the ability for the state agencies, because of whether it's through liquor or whether it's through places of assembly, those type of things. I think this question is more focused to the house parties, and that definitely is going to be within the jurisdiction of the municipalities or the form of government where it occurs.
Included in that too, just so everybody's aware, like colleges are working on their student code of conduct and other things, other tools that they'll have as well. And certainly they understand this, and they're focused in on that as well. But there are limits, right? So it's off-campus housing, it's away from the campus, whatever. It makes it more challenging, but they can still potentially hold students accountable. And I know that I don't remember which city, but one of the cities was considering or passed an ordinance to help hold landlords accountable. When we think about student housing, a lot of them are just individual houses with a lot of people, but there are common areas that can be controlled a little more diligently. So to Kevin's point, don't just stop at the executive order. Don't just stop at the fire code or liquor control commission or workplace safety. In those communities, do more. Just to give everybody some comfort, I know that MSU is doing more, and that they have planned, and they have a plan in place to, if this, then that.
Perfect. The next question is, if college cafeterias have to follow the same guidance as restaurants, then how should they limit the capacity to 50% when they are required to feed a certain amount of students?
Well, it would seem that they would need to expand their hours, right, to accommodate being able to maintain that social distance and the 6 feet of separation and otherwise closing buffets. I have been to the MSU food courts. I know that there's a lot of buffets there. Those cannot be buffet style now, right? So we need to really think through each of those pieces and make sure that we're staggering hours. They're keeping tabs on how many people are coming in. That's a difficult thing. I can tell you that, again, the colleges are taking ownership and control and making sure they're managing how that's going to work.
All right, and it looks like this one's referring to student employees, but it says, if an employee goes home for the weekend, can I require them to be tested before returning to work?
The question would be, why would you have them tested before they're returning to work? So the daily health screening is intended to kind of identify those things, and travel can be one of the questions. Some employers do, some don't, like where did you go and what did you do, and may require some further quarantine period depending on the type of workplace that they have. But testing capacity is, it's expanding, but it's not perfect yet. And depending on where you get the test, I've heard some are 24 to 48 hours. If you're at one place, some are 5 to 7 days. So if you assume that person coming back on Monday takes a test and they're not going to find out until next Tuesday, the quarantine period does the same thing. So you'd really want to think through why you would require that test. And if they're not exhibiting symptoms, if they're not going home to a place that's, has a COVID outbreak, if they're just around immediate family, so you'd probably want to ask more questions before you just went to, you have to take a test to get back in here.
All right. And are party stores required to have sneeze guards at registers?
Anywhere that 6 feet of social distancing can't be maintained, I would consider a physical barrier. Sneeze guards would be good. Employers do have some options. Convenience stores, there's a wide gamut of what they look like. Some have these huge counters where you're going to have 5, 6, 7 feet, but anybody indoors in that place needs to be wearing a face covering as well. So a sneeze guard, I think, would be a great addition to do that.
All right, and I know some of my student employees will not want to follow the mask guidelines. What ground do I have to stand on, and can I fire them?
Well, I won't comment on the firing, and certainly if you have a collective bargaining agreement with your employees, you should work with your labor union to navigate this. But if a face mask is required at work, if it's required by the employer, you should have the authority to, under management rights, to discipline employees that refuse to comply. It's important to note, Erica, before your next question, recognize that if there's a complaint filed, the employer is going to be held accountable, right? If the employees aren't wearing the face covering. So as an employer, you're going to want to make sure that you're using your tools to get employee in compliance. And as employees, if there are employees listening to this, we have to do our part too. I tell everybody I was an electrician by trade. I have been in the field. I know it's hot, it's hard to wear. You don't necessarily love it, but this is what we need to do.
All right, it looks like we might have had a little technical difficulty, Sean cutting out there, but thanks for ending that on. I'm going to move on to the next question, and hopefully we can hear you, Sean. I run a yoga studio. Am I allowed to have classes outdoors, and is it required that participants wear masks for those?
Yoga studios, depending on your region, but yes, unless you're in the north, but yoga studio, the rules are a little bit different, but yes. Yoga studios can have classes outdoors. You need to be able to maintain the social distance. You would not necessarily need to wear face coverings outdoors, although East Lansing, I believe, passed that ordinance. I'm not sure the impact that would have because that's new and I don't know the full extent and we'd want to review that. But you can have classes outdoors, maintain social distancing. The executive order on masking requires that you wear one outdoors when you cannot maintain 6 feet of social distance. So as long as your yoga class is set up where you're spread out, they would not necessarily need to be wearing face coverings while you're doing your yoga class outdoors.
Thank you. And how long do I need to keep the paperwork for health screenings?
MIOSHA is working through that question now, and I expect them to be putting together an FAQ and a better guidance on how long you keep that paperwork. For now, I would say hang on to it. And we'll get more certain than that, but for now, just hang on to it.
All right, and we have a question here from Bob Jones. And Bob is asking, can you please talk about the rules that restrict the number of people inside? I have heard 10 people is the limit, but I have been in restaurants with 20 to 30 people.
So it depends. The answer is it depends. And so if the executive order restricts events, so you can't have events with 10 or more people indoors. Now, just because they're in a restaurant does not change the nature of the event. And it's been, there's actually an FAQ from that executive order saying that just because the banquet hall is closed doesn't mean you can move your 20-person thing over to the bar or restaurant because they're open and not call it an event. So it's still limited to 10 people. Now, the capacity within a restaurant is 50% of your normal seating, provided you can maintain that social distancing. So as Kevin mentioned, the layout of a restaurant is going to be different in every single place. So I can't tell you exactly like how many tables that is. And neither could Kevin, but they could help you lay that out to make sure that you're at your capacity.
All right, and if I'm a business that has shared spaces such as bathrooms or lobby, how do we navigate who is responsible for maintaining those guidelines in those spaces?
So the first part of that question would be that for all of your employees, they need to be wearing masks. If you're in an office setting that's not open to the public, so let me preface it with that. They need to be wearing face coverings in common areas, hallways, break rooms, bathrooms, lobbies if you have one. If that lobby is open to the public, anybody in that space is going to need to wear a face covering anytime they're in there. So you'd want to do that. And then depending on how you're structured, if your landlord is normally responsible for that space, they're going to be responsible for that heightened cleaning and those other things. If your contractor or whatever has you cleaning that space, you're going to need to enhance your cleaning there.
All right. And are businesses expected to engage with patrons who do not comply with the mask orders? Will I be fined if patrons are not wearing a mask in our establishment?
Yes. Businesses, as the question indicated, are required to deny service to those not wearing a mask unless they meet one of the exceptions. And you cannot make a blanket assumption that anybody not wearing one meets one of the exceptions. Obviously, one of those exceptions is small children. You know, they're pretty easy to spot. For those folks that aren't wearing a mask that are medically unable, you're going to want to have at least a couple of questions to make a good faith effort to comply. We do not want confrontations. We do not want people pushing people out of the door. If you have somebody that has, what you'll need to do is ask them, are you medically unable to wear this? And if they say yes, or you can change the nature of that question to offer an accommodation. It could be, if they are truly medically unable to wear that mask, it could be curbside service. It could be make your order and I'll bring your food out. It could be several different things. It may be a face shield for that particular person to at least help contain some of the spread of COVID. Face coverings keep that spread down to just a few inches. If you sneeze, it'll go a little further. Face shields, because they're not enclosed like a mask is, aren't as effective. That's why it's not either or. But that could be an accommodation for that person. Maybe it's making sure employees are 6 feet apart, but the executive order is very clear that you cannot just make an assumption, and there was an update to it saying that you cannot just make an assumption that they meet one of the exceptions, including that they're not medically able to tolerate the face covering.
That's a good point on the alternate accommodations that you mentioned, Sean. We do have another question. Says, I run a bar and an individual says they medically cannot wear a mask. Can we refuse to let them in?
If you offer an accommodation and they refuse the accommodation, then yes.
Thank you. And if a business doesn't follow the safety guidelines, what are the consequences?
Depending on who would be enforcing in this case, I think that with the executive orders, there's a lot of departments that have some authority on different aspects of the executive orders. So if we're talking just workplace safety components that are impacting employees, and certainly a lot of those, one of those is specifically about workplace safety. So that could turn into a potential violation with MIOSHA, which has penalties of up to $7,000 for that infraction or that general duty clause violation of the executive orders. And so there are teeth there on the workplace safety side. I will let Barb talk about the LCC.
Yes, under the Liquor Control Code and rules, violations of the Act could be punishable by fines up to $300 per charge typically. However, we also could assess suspensions or revocations of licenses. If there's an egregious situation, we will probably look at it very seriously and have to consider those outcomes. Like I mentioned earlier, typically we're trying to educate people. Sometimes we issue written warnings. Those become part of a licensee's record, but there's no cost. There's no specific penalty. It just becomes part of the record. But we prefer to work with businesses instead of having to cite them. If you have questions, you're welcome to call me and I'd be happy to answer any questions. Hopefully keep you in compliance so that doesn't happen.
And Kevin, do you have anything to add there?
No, I think one of the things that we just need to look at is what we're really trying to do is we're trying to limit the gatherings, right? The size of the groups, and that's really no different than what the fire service has done forever. We would go to overcrowding at events and different things, and it is, you know, the duty of the person who owns the establishment to make sure that the capacities are maintained and they're not over capacity. And it's in the fire code, it speaks to that.
All right. And we have a question here from Candy who says, what are the concerns with HIPAA and employers recording information? How will it be saved, documented, etc.?
So I won't get too technical into the HIPAA requirements, but HIPAA and your privacy that's between a medical provider and you. So the questionnaire and those types of things aren't viewed, at least from a workplace safety perspective, as identifiable health information. You're just answering some symptom questions. If you're doing more than that, but HIPAA itself is related to your privacy as it relates to medical care and treatment. And there are other privacy protections, but just the basic questionnaire itself doesn't necessarily roll into, obviously you don't want to post it on the internet or something, but you know, it's not going to be a HIPAA issue.
Megan, who had a question earlier about student apartments, had a follow-up and would like some clarification because this is for off-campus housing. So Megan says that move-ins have generally been conducted as an assembly line setup with students, parents, and other family members present. Move-ins are generally conducted from time A to time B with no specific times for specific people. This would be almost impossible to do for 200 move-ins in one day. But she's asking, are we only allowed to have 10 people in our community room at a time?
Yes. Yeah.
Okay.
And I appreciate that. And I would ask, I don't know if some colleges are connected to the off-campus housing. And if there's a housing coordinator with MSU, I would ask her to contact them. If MSU doesn't work that way, shoot us an email and we'll try to find the right person that can help us make sure we get the message out to those off-campus housing folks that, you know, to try to work on how to stagger these things out and make sure they're doing that. But I appreciate that, and definitely something to think through and navigate through for sure.
Perfect. Well, that is all the questions that we've received so far. So with that, Sean, I'll turn it over to you for closing.
Well, I really appreciate the questions and the time that everybody took. I'd just really like to highlight just a couple of points. First, thanks so much to Barb and Kevin for joining and being able to answer these types of questions. You know, certainly we've been doing a lot of Q&As and we'll keep doing them. Check in as often as you can. Having Barb and Kevin really helps to expand the questions that we can answer because some of that stuff's not within the workplace safety spectrum. So that's hugely helpful and I really appreciate that. I want to remind you that, we can't get complacent. We need to be doing more. So when we talked a little bit, and we get the question all the time, like what teeth do you have? There are teeth, but that's not our goal. Our goal is to make sure that you have the information and tools that you need, and then we need your help to make sure you get those to the people that don't watch these webinars and don't check out the website and aren't really paying attention, because every business is going to affect the other business in this COVID crisis. And an outbreak, whether it started at a specific bar that's just doing some things wrong, doesn't matter. It's still going to impact all the rest of the establishments in that area. So we really need to tie in with our local chambers, our business groups, the Licensed Beverage Association, and others that are trying to really make sure you get this information and the tools to set up your workplace. And in college towns, don't forget about, closing those dance floors. They shouldn't be open. The performance venues, they shouldn't be open. Make sure you're thinking about the lines that you might get outside. We can do a lot of stuff inside, but one of the things we saw at a bar in Michigan, might have been in Lansing, was, there's a lot of people inside, but there's still 100 people lined up outside that are all within 2 feet of each other. Think about how you're going to maintain those crowds. Do you need to set more specific hours? Do you ticket people to come to your establishment? Not ticket as in a citation. Do you sell a ticket, give away a ticket or something, so you can control your environment and make sure that you're staying within those capacity limits and doing everything you can to contain COVID. Make sure you're engaging in a discussion to require face coverings in your establishment. We have to drive these numbers down. Early in the summer, it looked like we're going to be heading toward stage 5 in the near future, and opening some things up, letting us congregate a little bit. It got to be summer, and we have our backyard barbecues, and that's a containment, a spread point. We saw our numbers really go back up. College and K-12 starting is huge. We cannot be complacent about this. This is a lot of people coming into a relatively small area that we really all have to take ownership with to educate and get compliance with these executive orders and other tools that we have, as well as personal responsibility for our own actions. We all have family. It's very weird to go see your mom, dad, uncle, or whomever and wear a face covering. But that's just the world that we're in right now, and we have to accept that and move forward in that way. So don't get complacent, engage in the local community, follow the guidelines, think further ahead. If you get creative, let us know. We want to hear creative ideas too. Think about everything in your location that you need to try to control to prevent the spread of COVID, and make sure you continue to engage with us. And again, please help engage those folks that may not be tuning into webinars like this. And I appreciate you all taking the time. It's a huge commitment, but it's a huge challenge, and we can do it if we do it together. And our goal is to get open, stay open. So as long as we're all committed to that goal, I think that we can continue to move Michigan forward and contain COVID and have a great return to campus in a slow phased process. So thanks again, and we'll see you next time.